All right. Well, welcome everybody. Like I said, happy Monday. I can't believe it's already December. And welcome to our virtual learning event, Building and Bridging, Strengthening Cross-Sector Partnerships. Very long title, Sustaining Integrated Behavioral Health Services in a Rapidly Changing Funding Environment. Thank you. And just as we start every meeting or every webinar, one of the things that we invite you to do is kind of select like your own adventure here, your wellness adventure. I know most of you have already started your days with different meetings and just kind of getting connected to the work week, right? And so this particular slide just gives you a little nice reminder for us to just kind of check in and just kind of pick an area right here, right? So I filled my cup already. So I warmed up my coffee actually, because it's been sitting here for some time and it gets cold. But just the invitation is to really just to welcome you, glad that you're here, and then also just get grounded as we get started with this next webinar. And you already know who we are. We are the BHSSA stack. And I'm going to just kind of go through this really quickly because we have quite a bit of a beautiful agenda today. And so this is going to be our flow for today. We have a welcome and community connector. And then we have one of our very own guest speakers. It's going to talk about funding, understanding the funding landscaping, going through some of the foundations of fiscal mapping as well, and then integrations or ideas on how to elevate partnerships within our BHSSA work. And then there's going to be some resources that are going to be shared. And then we're going to wrap it up for some reflection and some follow-up information for you. All right. So as you join today, please, we invite you to write your name in the chat, what county you're from and where you're joining us from. And so as we think about funding and sustainability, if you can design one simple shared system for building and sustaining mental health services across schools and community partners, what feature would you make sure that it has? So what feature would you want to include? What would this look like? Hi, Miriam. Hi, Jessica. Share data that follows HIPAA. Awesome. What data? What information would you like to include? I think some people might think about a standardized billing codes for school mental health so that providers don't have to reinvent the wheel, right? That might be something that you might be thinking about. Any other thoughts? All right. So as you think about this particular question, there's going to be opportunities for us to kind of chime in and join some of the information. So I see collaboration in here as well. That's one of the biggest pieces that we think about when it comes to sustainability in schools. Share a database of insurance eligibility verification and auto billing submission system. Thanks, Vera. Logan indicated share list of billing codes actively being used by fellow counties. Yeah. Tracking and referral outcomes, right? Shared language and data systems. Yeah. Lots of really great designs here. All right, well, thank you so much for sharing. All right, and now we're going to transition over to our presenter for today. So I'm going to have Michael Lombardo join us. Thank you for being here and get us started.
Great. Thank you so much. Can you hear me okay? Awesome.
Yes.
Fantastic. So good to be here. I see a lot of familiar faces in the room, so thank you all. I may pick on some of you throughout the meeting because I know your names for some feedback and at each section. So my name is Michael Lombardo. I'm a consultant for California Health and Human Services, as well as some county offices of ed, and I'm part of the TA team for the STEC. And prior to this, my experience is working in education for about 13 years, and then also working in behavioral health in Placer's Children's System of Care. So I have that dual lens of how we can integrate this work both programmatically and fiscally. Before I jump into today's objectives, though, I do have to say that things I say are Michael Lombardo's opinions and voice and don't necessarily reflect the STAC or California Health and Human Services or Healthcare Access and Information or the Department of Mental Health, DHCS. They're my opinions, and just want to make sure I get that out of the way. Also, don't consider anything in this presentation as legal advice. If there are questions, I always encourage you to both go to your human resources, your fiscal people, and any legal representation. Okay, see if I can make this move forward because that picture is making me feel awkward. Today's objectives. Okay, so let's get into it. Oh, also two other things. I cannot think in my brain if I don't move my hands. So I know that's a big Zoom faux pas, but I'm going to do it. And the other thing, number two, is I'm going to stop at the middle or at the after each section, and we're going to do some questions there. So wanted to get some of those out of the way. Right. So today's objectives. We're going to explore how to braid and blend funded systems. And I see some folks on here who are doing some fantastic jobs at that. And I see folks I know who are at the beginning of that journey. And there's probably a few of you who are like, what the heck is braid and blend mean even? So we're going to help you clarify that. We're going to identify some strategies to align and sustain integrated behavioral health services and education and community providers into a whole ecosystem of program and funding. And then we're going to strengthen cross-sector collaboration, governance roles, workflows, and those sorts of things. My hope for all of you, because we're in this for about the next hour and 10 minutes or so, it's not going to teach you every skill, how to do every skill, but I want you to take away nuggets from today. So what I want you to do is, and I'll ask you at the end, I'll forewarn you on our last question is going to be, what did you take away from today? What nugget or item or area can you further explore, want to further explore? So without any further ado, we'll jump into part one, understanding the funding landscape. All right. So some of you have seen this before, but over the last 10 years, we have had a tsunami or tidal wave of funding. I've done this work for 30 years almost, and I've never seen the level of investment we've had in the last 5 years. And a real tsunami. These dollar totals are approximate, but now we're faced with what happens when a tsunami hits the shore. If you look real closely at that red arrow, that's us. Like we are fleeing for help. The wave is crashing. These grants are going away. Um, most, if not a lot of, probably three-quarters of the funding is ended in the next 3 years, all the way up to the termination of community schools. And I think it's 2030 now. So how do we deal with that? How do we get to high ground? How do we navigate the hazard zone of what happens after you enjoy the benefit of all those dollars? So we need a life preserver or a life raft. And I want to propose to you that braided and blended funded is that life raft. And I said this on a call the other day, but um, if some of you were on it, you heard me say there is just no universe that I can find where we're not integrated and braided funded, where we're not using multiple funding sources. Give me 1 second. Oh, wrong my throat. Okay. But we want to be very careful when we do that, that we truly know the definition and the difference between braided funding and blended funding. So braided funding is that strategy that combines multiple funding sources. Keep in mind, each of these funding sources has rules, regulations, restrictions, um, priorities, and something that your fiscal agent is going to be tracking, hopefully. So we have some parameters around braided dollars. Blended funding are those dollars that can be used for multiple things. So technically speaking, I'm going to talk about this in a few moments, but technically, the way HHS and the Department of Healthcare Services has set up the fee schedule, those dollars come into your agency unrestricted. So technically, you could use that for anything. I would encourage keeping in line with behavioral health, cost of staff, program cost, and those things, but there's not a restriction on it. So you could blend those dollars into the continuum of support rather than something like homeless foster youth dollars. Those have to be used within this bracket specific to what the priority is for why we got those dollars. The reason I'm emphasizing it too is you can get yourself in a little bit of trouble here. So it's important that you know the difference, that someone in your office is carefully tracking it. I'm going to give you some tools to do that. And that we're monitoring the spend down of those restricted dollars in the braided environment, right? In Michael's brain, it looks like this, where we're taking multiple funding sources, potentially ECM through our managed care plans, county, EPSDT. I'll explain what some of these are later. Education, Medi-Cal, ESMA, LEA BOP, managed care dollars, probation dollars, health and human services dollars like Families First Prevention Services Act or the prevention of CSAC, education, and fee for service dollars, where we can use all of those strands to create a tighter rope to fully meet the needs of children in schools. I heard a saying the other day on a webinar that a bundle of sticks is harder to break. That's what I think about. I thought, wow, that really reflects on why we need to integrate or braid dollars. This provides us that lifeline opportunity through braided funding. Some of the key features that we're going to look at today are fiscal mapping and vision alignment. So to braid dollars fully, we need to identify and coordinate the existing funding sources, and we need to have some vision and alignment. And that means we need to work with our partners and shared goals and outcomes. We're not going to touch as much on the next two, governance and decision making, although I think that goes into vision and alignment to some degree, and data and accountability. Maybe we'll leave that for another day, but I think Christina put that in the chat, but we will talk about some accountability, don't worry, during this presentation. So we'll get into those features. So part two, really, we're going to focus on the foundations and fiscal mapping. So I'm going to give you several tools in this section because we face in education this fragmentation challenge. There was a day where we did this work where all of our dollars came in silos or core dollars. Since LCFF, it's a little bit better, but I would still suggest that it's a bit siloed. And one of the reasons for that is how we set it up inside of our systems. So when I was with Placer County, I would have this thing called a resource code, and another director would have a resource code, and another director would have a resource code. Each one of those resource codes kind of embargoes the dollar into my responsibility. While Placer County Office of Education was super integrated, it still tends for you to think in a silo because these dollars are my responsibility. So we end up with something that is siloed or disconnected through the funding streams. Uh, you need to make a conscientious effort to think about, well, how do I work with uh, our early child education department, and are we integrating those funding or braiding that funding together? In not doing that, it ends up with service gaps or lack of coordination, or not in Placer County, but in some places I've worked in the past before Placer, or what I see in the field is a bit of Hunger Games. This is my pie. It's my slice of the pie. You can't have any piece of my pie because that's my responsibility. All that leads to is service gaps and ineffective and inefficient use of dollars. And it also contributes to difficulty in navigating um, the use of those dollars, as well as supporting our families and educators to navigate in this very, very complex environment that we're in. So let's look at some tools around fiscal mapping. I want to define it for you first. This is the strategic, by use of strategic planning tools. The other day, someone said, well, I think the question was, how do we convince others? And one of the way to do that is to use some of the tools that I'm going to show you. The question was, how do we convince others that there's a need for mental health dollars to be directed towards children where they're at in schools? And my suggestion was we visualize that. We create a clear map. So I could go to my counterparts in behavioral health and say, here's where we are. Here's the funding levels. Here's the dollars that are leaving. Here's the dollars timeline. And here's what's going to happen if we don't have those funding, the funding source. So to be really transparent and talk with partners about the long-term sustainability. You're going to hear a lot about partnerships, and some of you might think, well, I don't have very good partnership, but it is so critical to survive in the tsunami. The benefits of collaboration then are reveals assets and gaps that we might not have known we even had. I'm going to pick on Placer examples a lot today, but at some point while I was there at Placer County before I left, the early childhood ed director said, you have those people, like those licensed people, right? I said, yeah, I've got a lot of them. Probably at that time I had maybe 10 or 12 licensed people on board. He says, well, I have early childhood mental health dollars. And if we collaborate together, I can move those dollars to your budget, Mike. So how would you like to get $50,000? Like, oh, yeah, heck yeah, I would love that. Because it relieves some of the burden on that staff position. If we weren't integrated or having those conversations, it really wouldn't reveal the assets or some of the gaps in services. Integration or collaboration helps us enhance those partnerships. Marion is somewhere on in one of the boxes out there from Imperial County. And big shout out to Imperial County. They are knee deep in this journey of integrated collaboration through transforming together. And coming together, I go down there every month. There's your managed care plan, your child welfare people, your mental health department, all working together to look at how can we as a leadership team more effectively and efficiently use dollars. It also helps reduce duplication. This sometimes is a large problem because we're focused on mental health services for mild to moderate, but we might have an agency that's also doing that. Often it could be a community-based agency or it could be your managed care plan. So having integrated team meetings or the work that Christina's doing through ISF, we can recognize and more efficiently and effectively use those dollars and reduce duplication. And it does drive data decision making. So whether it's at the ILT level or the system of care level at the top of our county organization with the decision makers, or whether it's embedded into a cost or care team or ISF team, we are more able to use that data for decision making. So going on with fiscal mapping, the first step is to identify those resources, determine resources needed for our comprehensive mental health programs. So what is it going to take to do this job? To identify all potential funding streams across all agencies. So we might have partners, and you'll see an example of probation in a little bit that has these dollars, forgetting what the acronym stands for, but JBOG, JBOG, and then Juvenile Justice Crime Prevention Act, JJCPA. Both of those are excellent funding sources, but by working together collaboratively, we can identify where we might use those funding sources more strategically, especially in light of our MHSA cuts that are happening. To be careful and with our partners, specify very clear objectives. So to write those objectives out, to have a strategic plan around those objectives, and to have agreement across our collaboration. And I want agencies to be very specific and literally write out what is our project plan with these dollars. We tend to have some high turnovers in all of our agencies sometimes. And as people come and go, if it's not in an MOU or if it's not in a contract, we see a lot of drift happen. So I want you to also sit with our collaborative partners and brainstorm strategies, generate creative financing strategies with our stakeholders in mind, but also with stakeholder input. So the Behavioral Health Service Act, or MHSA, is undergoing a process right now. I think it ends on December 19th of stakeholder involvement. So in all of your counties, and there's likely some mental health people on the call today who are county representatives as well as education representatives, we're going through that stakeholder process. And it's really important to have that connection and get input from those we are serving, um, especially when we look at across the ecosystem and it's so dynamic and there's so many changes at this time. We want to link and map. I'm going to show you a strategy how to do that, how to connect, how to make that braided network of resources, and then monitor and adjust the progress we're making with our students and children. So to be very clear, we're going to need a collective vision and mission. What are we for all kids? So in Placer County, we are focused on all kids being safe, respectful, responsible in school. I'm sorry, safe, healthy at home, in school, and out of trouble. My PBIS brain took over for a second. Um, we want them to be safe, healthy at home, in school, out of trouble, and then we added economically sufficient. So if that is our mission of each agency involved in the fiscal map and process, we can more clearly focus those resources on on our children and families that we're serving. So one way to do that, so one tool that I want you to think about is this fund and life cycle. This isn't really a health and human services um, model. I guess what I'm saying is we don't technically operate that way a lot of times through health and human services or education. But all dollars go through this life cycle, whether you're a small business, a big business, Starbucks, Amazon, or um, funding school-based services where we'll receive funding. We grow those dollars. We develop an implementation strategy. We should be thinking about sustainability and data for decision making during that growth stage. We get to this maturity stage, and I think that's where we are now in BHSSA and maybe a few of the other grants. The capacity grant most certainly is in this maturity stage where if we're not thinking about sustainability and planning for innovation, our runway is very short at this point. I wish I had ability to move that arrow over to the introduction stage because we probably should have been thinking about sustainability then. I get calls every week from people saying, what can we do? We're going to run out of BHSA dollars or we're going to run out of capacity grant. We need to sustain this program. And we are near and out of time to think about and learn how to and implement our collaborative strategies for braided funding. Then we get to this decision stage where we create an innovation. How do we keep these dollars going? How do we keep this program going? So an example coming up might be taking enhanced care management and braiding that with our supports through CYBHI. So everything follows that life cycle, and we are just on the precipice of the cliff, right? Just like the tsunami diagram I showed, this model is used throughout business, and it is just a truism of funding. And so it's really important to think in terms of this life cycle. Now, what are we going to do as a collective group to intervene in that funding life cycle? Improve services by seeking additional funds, by changing staff roles, by behaving differently, by pushing more prevention. It's the best funding strategy you can do, but we need to intervene in that, or we're going to have some difficulty coming. This is what I was referring to a few minutes ago. I think we need to tell the story really well. So these are some numbers from my previous life, probably very changed right now. But how long do we have our MHSA dollars, foundation grant dollars, ESSER, SB HIP? What I'd like you to do as you work through these collaborations is think about your budget. How are we using the dollars in our resource code? How are we using them most effectively? And then being very clear, like these dollars end on this date. So you'll know where you are on the curve. You'll also be able to go to our partner agencies and say, wow, CYBHI dollars for capacity grant are ending, certainly in 28, right? Yeah. Give me someone a thumbs up if I'm right. 28. And then to get to those billing levels, it's going to take us a while. So to have those conversations with our partners about potentially filling the gap, we need to show a data picture or a reality picture of where we're at. Some of the best practices for schools and districts and partners to think about integrated funding is to align funding and follow these simple, well, not so simple steps, but to follow these steps of aligning those dollars together in strategies using our local, state, federal dollars, Medicaid dollars, philanthropy dollars, and identifying, as I said a little bit earlier, what are the flexible dollars or what are the restricted dollars, and we need to align those together to do regular updates, refresh our maps on a regular cycle. Back in Placer when I was there, we met every Friday early afternoon with our fiscal department to do a fiscal check or data check and look at funding sources. I really encourage you, whatever county you're at, to set up regular fiscal meetings. And then I think we met every other week with behavioral health to check in. If we don't do that, or if you're not having regular updates, these things tend to sneak up on you. And suddenly we're in the last month of a grant, and there's a lot of trouble because we don't have a sustainability funding source. Or what happens sometimes is if we're all collectively meeting together, you might find that one department or one agency has dollars that they need to get, I guess, need to get rid of isn't the right words to use, but need to move or they get swept or lost. And so you have an opportunity to maybe gain additional dollars. And I'll use an example of foster youth. Sometimes CDE will put out a notice, April, May. Guess what? Your foster youth dollars are going to increase by $15,000. That's great. And we can always use that. But the pie is already built. Your budget is built at 100%. Where do you put that $15,000 in? So if you have a really clear fiscal picture and you're using some of the integrated tools, you'll know where you can put those dollars in. Using data and creating kind of a center for equity and culturally responsiveness. Um, there's no single better way than CYBHI's um, um, multi-payer fee plan, fee schedule that creates equity for children, serving children where they're at in schools, making services available to them, creates a more equitable environment for kids to access services um, and make those services more available in the environment where it works. Engage the diverse teams we talked about, but really consider utilizing or optimizing this 2083 team, AB 2083, or integrated leadership team. And each county in the state is required to have an ILT under Assembly Bill 2083. So you already have a partly baked system of leadership in your county. Innovate in that to include more partners, I think is the way to help um, both engage diverse teams, but to look beyond just our county folks to people like our managed care plans, our native community, as well as whatever local ecology you have, early childhood education or first five, to think about having all of those groups represented in your leadership team. And so we need to start by looking at a needs assessment, really identifying what's pressing the mental health priorities as well as student needs, and using comprehensive evaluations to support how we're implementing some of the programs that we're implementing. We talked about resource mapping already, but I would suggest using a tool, and some of you are probably already using it, by the National Implementation Resource Network to map all of your resources. It's a good way to both, one, look at program implementation as well as funding that's attached to those. Fiscal mapping and using an actionable plan. I already talked about creating very specific plan where you and your partners can take steps. So a little bit of an activity in one sentence in the chat. Which funding stream do you currently rely on most for student wellness and behavioral health? LCFF, Medi-Cal, capacity grant, the fee schedule. Hope to see some fee schedules in there. MHSA. So if you could pop those in the chat, I'll go over and see how we're doing. So how are you currently funding things? I could always call on people too. Oh, there we go. That always works. MHSSA fee schedule and the fee schedule, capacity grant, BHSSA grants, HCI Wellness Coach grant. I don't talk about that much here, but it's a great resource. MHSA, BHSA, CYBHI, BHSSA, capacity grants, LCFF, HCI, BHSSA. Excellent. All good. BHSSA Medi-Cal. Fantastic. All of these are really good opportunities. What I don't see is collaborative funding where it requires a partner agency. So the example is our upcoming, or a lot of people are using ECM already, enhanced care management, where you need them to be part of, and you need to have an MOU or contract to exchange those dollars. I guess the fee schedule is a little bit of that. In one phrase, drop in the chat where you do see the biggest fiscal gap or duplication, staff and data system supervision, care coordination, screen, and crisis. Where do you see the biggest fiscal gap for you? Give me a second. Let me take a drink of water. Okay, county behavioral health. BHSSA moving towards CYBHI in the fee schedule. Good. Where do you see your biggest gap? Go ahead and drop it in the chat. Awkward wait time. There we go. Staff and retention, billing, complications. Yes, for sure. Lack of understanding across systems regarding administrative details and HIPAA, FERPA. How do we talk to each other and implement integrated programs? Billing, Braden funds. Excellent. Okay. Hopefully, through today, we'll be able to um, give you some strategies to start filling the gap a little bit. Before I get into this section, we only have 29 of you here, so I'm going to give you a chance to ask questions now. You can come off mute or you can ask them in the chat. Of those strategies, the funding strategies that I showed, um, what questions do you have? Everybody always turns off their cameras when I ask this question. It's like being on Southwest where you look down. Miriam, what questions do you have from Imperial County?
I mean, I think a lot of people want to know the cross regulations, the allowable usage. I mean, the commonalities, the things that differentiate the different funding sources, the regulations, the rules, those kinds of things to ensure that um, I think between braiding and blending, it's more about braiding sources to ensure that those braided funding sources are being utilized correctly and where there's commonality and where there's differentiation, those complexities.
What are the guardrails?
Correct.
How can you actually use these dollars? And you make a really good point. Many years ago, this wasn't Placer County Office of Education. It was a different agency that I worked for. Our fiscal officer went in to my budget and used funds for a different person. And luckily, I caught that in time because those funds were very specific and intended for this type of work and this type of person. While it filled a gap so nicely, it violated what you're talking about. It violated the rule. It went above the bumpers into the gutter. And so we need to be really careful or be acutely aware that you know what those local rules are. Sometimes in your agency, there might be a culture that you need to be sensitive to as well. Good point. I'm looking up in my right corner here at Mandy from San Luis Obispo. Hi, Mandy. What questions do you have about fiscal mapping?
Hey, Michael. Well, fiscally, I think what's we're struggling with right now is a lot of billing complications, specifically with the CYBHI fee schedule. We're having a really difficult time navigating just like onboarding onto that system and jumping through a lot of the hoops with our LEA is great that we're partnering with. It's just navigating all the ins and outs. It's kind of, we understand that our LEAs in the cohort one and the CYBHI fee schedule is like, you know, building the plane while it's being flown, and we're having to pivot constantly. And I just feel like every time we make three strides forward, then something happens and then we go 5 steps back. And it's extremely frustrating. And then while as a supervisor trying to navigate that with a team who are the boots on the ground and trying to, retain that team who's actually the ones billing and providing those services is really difficult. So that's kind of like where we're at right now is trying to build and bring in revenue and also trying to keep morale strong with my team while this uncertainty is there with billing and CYBHI changes and that's fiscally kind of where we're at and slow.
Well, it can be exhausting to
Yes,
program,
very
right?
exhausting.
If we're trying to navigate at the same time, there's this level of stress where we're
Yes,
asking staff to participate, but the environment still is maybe a little
shaky.
changing. Yeah, just a little
Hmm.
flexible. So maybe flexible is not even the word, but it's a hard target to hit because it keeps moving.
Yes,
Uh,
absolutely. It won't just stay still. And so it's trying as a supervisor trying to keep my team focused and positive and in the background I'm internally like screaming. Um so I'm hoping for some stability soon and just some and I see it, but it's I wish I was a little closer.
yeah, I think we all do.
Hmm.
One of the ways to navigate that is if we go back to our fiscal map and get a clear picture of what are the multiple funding sources? What's our safety net? How do we
Yeah, and luckily in behavioral health, our safety
fill
net
the
is our
gap?
Medi-Cal billing. Like we have our
Right.
Medi-Cal billing and our specialty mental health services that is kind of saving us right now. So we're grateful for that.
And in San Luis Obispo, it's a unique situation. We'll talk about this in a minute, but it's very EPSDT or use of specialty mental health dollars is dependent on each county. So each county has a slightly different way of implementing. And I go back to the last section, it requires partnerships, or the section we're headed into. Having really strong partnerships allows for that. In some cases, like Mandy, it's the county folks who are doing EPSDT, but right in on a campus. In other cases, like Fresno, it's the county behavioral health department authorizing Fresno County Office of Education to do those services right on a campus. And so between those two, there's probably 3 or 4 iterations, but it's that relationship with behavioral health that will get us there. The challenge for us, we heard from some of the questions, is that fragmented streams that even CYBHI can be fragmented or focused on a specific area of mild to moderate students. We're still trying to deal with the pandemic impact, although I think that we always had a mental health crisis, just the pandemic amplified us to be able to see it better. But I think there was always a mental health crisis. And then maybe it exacerbated it too. Our partnership pathways and integrate and fund in through our strategic partnerships. And that was an example in San Luis Obispo, Mandy, and County Behavioral Health and the managed care plan meet about once a month. In fact, I think we're meeting next week to talk about how does that partnership pathways work towards our integrated funding is going to be one of the modules that we go through. So elevating our partnerships around leadership and distributed governance. We had a judge in Placer County who once said, put the money on the table and your hands behind your back. And that sounds like a really provocative quote or an urban legend. Judge Cousins really believed that these dollars belong to the children and families and not us. That this isn't my slice of the pie or my resource. I'm just allowed to help support it. And so I think it's important when you think about all of us, because I know we have multiple agencies on here, when we think about success for our children and families, how can we leverage dollars in the most effective way? Does it make sense to have a mental health practitioner doing the work if there's already LCSWs in schools? Maybe in some school sites, but in other school sites, we should do the reverse. So to really think about how to best leverage those dollars. Sometimes with, I'll use the CSEC example in Placer, it made more sense for the County Office of Education to do the prevention training and support and teaching. So that's what we do. Than it did another agency. So to leverage those dollars to be most effective, to have shared decision making. A non-example might be when at one point we had an agency receive a big grant award to do wraparound, not the social services agency. An agency applied to do this grant to do wraparound and announced it to our leadership team. Nobody knew that was happening. And we could have more effectively collaborated if we knew that they had even applied for that grant. So one example. Partnership in teams and action. So I just really want you to think, I can't stress it enough, to look at your 2083 process, your integrated leadership teams. The state of California teed this up for us so nicely. It's up to us to expand that more, to include foster youth, but to look past foster youth and include all youth and prevention. Expanding that ecosystem throughout our partners, connecting with schools and community-based organizations, even businesses, for-profit businesses, as well as our community-based 501(c) businesses, government agencies. There's our nonprofit providers to help support the network, just like we do at a school site where we have a cost team, but at the higher levels of governance in our county to think about that integrated structure. Some of you are there, some of you are on the way. What I hear often is we go to these meetings and there's reporting out. Like people report, this is what we're doing, or this is what happened this month. But we're not really looking at it as an opportunity to do integral decision making and building our one relationship and our partnerships, but also being able to put the money on the table with our hands behind our back. To build those effective partnerships, there's 5 key steps that you can take. One is to audit the collaborative resources. I think number one, we probably could have spent the whole hour and a half on it. We need, this is a bold statement. Like, this is showing my cards, really laying them on the table and saying, this is where we're at. So rewind 15 slides or so, that picture I showed. Here are my resources. This is the reality of my fiscal situation. This is what I have. So it's playing like card up poker, I guess. I don't play poker, but showing the face cards. We have to be able to be transparent in the work and then audit what are all those resources and how can we as a group best use those resources. We want to then establish shared fiscal goals and outcomes. So if all children are going to be safe, healthy at home, in school, out of trouble, how are we going to get there? What are the fiscal levers we have to make that happen? Is it like in Stanislaus, where Mandy and her team are looking at combining some CYBHI with specialty mental health services, and other places it's leveraging CYBHI through education personnel and the county doing specialty mental health, and another place like Fresno, it's the school doing specialty mental health. But how do we use fiscal goals under that defined shared vision of safe, healthy at home, or whatever your shared vision is? This is really hard, so start small. I was thinking earlier today, we tend to, especially now because we are headed into that fiscal crisis, get over our skis a lot. And I think if we can start small and really think about pilot projects where we can exercise those muscles and build trust between the agencies, that is definitely the best strategy. This is not a sprint. You've heard me say this before. This is absolutely a marathon. And it requires also establishing norms about how we operate with each other. What do you do when those norms are tested? But definitely want to build that trust in between and through the collaborative partnerships and evaluate and adapt. So every couple months or every month or every week, in the case of a school site team, how are we doing on our budget? How are we being effective? Are we being responsible? Are we getting the outcomes that we intended to get? Okay. Before I treat you to the funding sources, I'm going to look for questions about integrated collaboration. Any questions you have? You heard some comments from Mandy and Miriam. Anyone have questions? I'll ask a question. Are any of you part of your integrated leadership team, your ILT? Or do you even know if you have an ILT in your county? I saw a hand go up. Miriam's there every month. I will see you next week. I go see Miriam in Imperial, then I'm going to see Mandy the next day. So yes, they do. I know Christina has a system of care team. Other counties. Amber, Megan, go. And where are you from, Enrique? I think, or I can't see it. Sorry, it was in the
Eugenio?
chat. Yeah, what county are you from?
Hi, Michael. I am from Trinity County.
Trinity County. Oh, great.
Yes.
So you don't have an integrated leadership team, is what I'm hearing.
So if we do, I'm not part of it. I work for the prevention and intervention
Okay.
unit here. So we're responsible for the CYBHI, fee schedule, BHSA grants, community schools.
Okay. Excellent. One thing I'm going to suggest, I'm glad you brought this up because in a lot of counties, people don't know if they even have an integrated leadership team. And I think it's imperative that that integrated leadership team cascades down to the school site or the district and the school site, that we know we have this leadership group that we're responsible for. So I know in Trinity you must have a 2083. I don't know if it's as integrated as others or not. But that's where we could start. Whether it's Trinity, Shasta, Solano with Vera, um, wherever you're from, I know there's a 2083 because it's the law, but to what extent has it matured? We don't know yet. Okay, so I'm looking at the time and I better start rolling. Part 4, integrated funded and resource opportunities. So we have part of that fiscal tsunami and all that billions of dollars in grant funding going away. We have forged some new opportunities that I'll talk about in more depth. But because of the grants, we've created opportunities for integration and for new resources. I think the single most important event that's happened or funding grant that occurred actually is BHSSA, that the Behavioral Health Student Services Grant, or when awarded, originally it was called a triage grant, and then it was the Mental Health Student Services Act, and now it's the Behavioral Health Student Services Act, is the single lever that really amplified why are these partnerships important and how and can we use this level of partnership in schools to support children's mental health and well-being where they're at. And that impacts child welfare, it impacts juvenile justice, it impacts academic outcomes. So when the commission had this vision of these dollars, it was to look at the integrated outcomes we'll get, but also how do we collaborate more intensely? And then the next single most biggest event was probably SB HIP. I'm not going to spend much time there today, but SB HIP happened because the legislature felt that our managed care plans weren't maybe collaborating as best as we could with schools and others. And that varied across the state. But by infusing these dollars to create the opportunity for those collaborations, I think that along with the fee schedule, those are probably the two most impactful events for sustainable funding that have happened in most of my memory. And with managed care plans, through Medi-Cal reform, there's this new support called enhanced care management, or ECM. It's whole child community-based care coordination to benefit this children and families with the most intense needs. I will follow up with, actually, if Angela, if you could put my email address in the chat, if Trinity can shoot me an email, I will follow up with you. I know the answer to that question too, through partnership. So enhanced care management is a strategic opportunity to fill the gap. Let's move over to our social services collaboration, Families First Prevention Services Act. So that falls under some federal funding called Title 4E. It used to be that these dollars were required to be used for only foster children, but they expanded it to children who are at risk. I'm not sure that I have those slides in here today, but if you contact me, I can dive deep into FFPSA with you and connect you with some folks who are doing some innovative work coaching. How do we do integrated Families First Prevention Services Act? Certainly CYBHI, the multi-payer fee schedules, Mandy and others we're talking about. It's one of the big sustainable levers. So, I hear every so often, should we do CYBHI? And that answer is emphatically yes. Um, it is hard. Nothing like this has ever been done in the country. So we're still sussing out, we're still getting through. Um, the implementation evolution or evolve in our implementation, but I think that CYBHI is probably singularly one of the most effective ways to support kids in and around schools. Juvenile Justice Crime Prevention Act, or there it is, the Youthful Offender Block Grant is a grant that's given to probation departments. It's a little bit misnomer to call it a grant, though. That's why it made this list. It's a funding source that happens off of the vehicle license fees in that county, and then those counties pull it across the state. And then there's a distribution to county probation departments. That funding is used quite extensively to support mental health or social emotional learning in a lot of our counties. If you haven't heard about it or if you're not aware, I would look, Google, look on the website for probation, or have a conversation with your probation department about what they're doing with those dollars if you're not already involved. Business partnerships and philanthropy can be, um, I wouldn't say it's the cupcake. It's definitely the icing of your fiscal cupcake, but keeping those relationships up can be really beneficial for your county. In Placer, the Sutter Health Foundation was extremely generous in helping not just Placer County, but fund PBIS across the whole Sutter footprint. So those relationships can be quite valuable. Kaiser comes to mind. They do a lot of community resource funding through their community benefits grant at Kaiser is what it's called. So keep that in mind as you think about filling the gap and supporting ongoing dollars. Prevention of commercially sexual exploited children, CSEC, is a great funding opportunity. Each of our social services departments is funded to prevent CSEC. And we know, and several counties too that come to mind is Calaveras and Placer, have integrated those dollars between social services and education. So that's another strategy to support integrated funding. And those are all ongoing dollars, except for maybe the business partnerships. But I thought it was important that we put it up there because we often forget as we spiral around in our day-to-day work that could be a hugely beneficial funding source. So let's look at the CYBHI fee schedule. Many of you are not rookies to this, so forgive me for reinforcing what you already know or heard, but there's a lot of new people on there. Oh, HCI, yes. Thank you, Vera. Yes, HCI and wellness coaches would be a fantastic opportunity as well. I think I have an example coming up. So the fee schedule was designed specifically to support our children in schools or related to schools by utilizing their commercial insurance or their Medi-Cal benefit to do mild to moderate services underneath EPSDT. So the fee schedule is not specialty mental health services. I run into some clinical folks who think you need to do a biopsychosocial assessment for the fee schedule. You probably don't unless you're doing individual, but it's a lower level of assessment that you're able to do. And if you ping me through email, I can send you assessments where you can create a care plan and be in pretty good shape to meet medical necessity in the fee schedule. Here's an example of the fee schedule for case management. There's your procedure code. So all of the funding in the fee schedule is linked to procedure code. If you click on this link, that'll get you there. Case management and the procedures code is 30 minutes face to face. All of these individuals are eligible. So it's quite a long list of folks. The ones in red are most recently eligible to do case management. And then it pays $36.71 per half hour. There's this thing in mental health called the midpoint rule, because you might be thinking, wow, I don't really do face-to-face counseling with a child for 30 minutes. It's sometimes like, 8 minutes here, 4 minutes here, and another 8 minutes. That's 20 minutes. It's not quite 30 minutes. That's okay because you're past the midpoint. So if you go past 16 minutes, you can bill for the full 30 minutes. It's I call it mental health math. But the good news is that you're able to bill for that full time. Because in schools, we have to do what's called stacking. So you can stack that time together to get reimbursed if one of these people on the eligible provider list worked with an eligible student for $36.71. Frankly, for services you've already been doing. A lot of you have seen this spreadsheet that I created. One of the first questions I had when the fee schedule was launched was, is it worth it, Mike? Can you show us that it's worth it? So I created this tool. It does not reflect, again, our Department of Healthcare Services or any other government entity, but it's a calculator that helps you calculate fund and reimbursement. This is not an extensive example, but if you had an LCSW who was doing case management throughout an entire school year, so that's 217 days or 1,736 hours in that year, and that person was a full FTE doing 20% of their time, which is 1 day a week, your reimbursement for that person would be $25,000. Is the fee schedule worth it? Oh, it's already worth it right there. If they did individual at the $131 an hour for 15% of their time, so that's just 6 hours a week of individual, $34,000. Family psychotherapy, single family without the student present, 50 minutes, $86, 5%, $7,000. And then preventative medicine and individual counseling, another 5%. So if your person or one of you did a total of 45% of your time working directly with students, right? That can be reimbursed up to $74,000. Average cost for me was about $130,000. We only have a $55,000 gap. Like we're almost there. So I think the fee schedule absolutely is worth it. And there's ways to make up that $55,000. But I want you to take a look at that. That's 45% of a staff person's time. So that's less than 20 hours a week. And so documentation, meetings probably don't add up to 55%. I used 45% because I didn't want to create unrealistic expectations out of the gate. This is all new for folks. Not new for some of you who've been doing this. But as we go along this journey, we can increase that time by fluency. And let me switch the slide. There we go. It looks something like this. So this is just a model. These aren't actual people. But I really wanted us to think about, we're starting over here on the left side, many of you in year one. The reality conversation we want to have with our partners is to debunk the myth that CYBHI is funding everything, it takes a while to build fluency, to build those dollars, um, or I'm sorry, build the ability to document and file claims to be reimbursed. That doesn't happen overnight. So in this example, you have employee one who has a pretty good trajectory to 40-ish%, and then they kind of leveled off. So there might be some conversations there about how to support that staff and get that higher if you needed to, or maybe 42% is that person's billing expectation. Employee two dropped to 20% from 40%, because if they're not seeing kids and employee two was in a car accident or had medical leave or was off work or had a temporary transfer and they're not seeing kids, the funding goes down and then they rebound back up in year four. You only get funded for children you see. So this is not the 100% current grant funded where Christina gets funded for 1 year, period. This is reimbursement for activities that happen. So the conversation to have is, how do we fill that gap? We will never be at 100% most likely, except for maybe wellness coaches. Somebody put that in the chat. Wellness coach funding, interestingly, is high enough that if they do something like 65% of their time, you could probably fund them. I don't think I have the spreadsheet here, but you can contact me. For our other staff, it's a challenge. Vera, nice to hear from you.
Yeah, hi Michael. I really like the tool, especially the Excel and this the financial tool you just introduced. The question I have is because I know school schedule is typically in sometime 1:30, 2:30. So I'm trying to start in the activities.
Okay.
So to communicate with leadership, what's the a day look like, and then do they do telehouse after school? Is the school district our school is comfortable for staff to reach out to family after hours before 5 o'clock? That's why I want to hear your thought about when we communicate those time. What's that look like?
What's the reality of it? Like, what really happens throughout the school day? So that's why when I created this example, I used it, and every district's different. For us, we did 217 days, that's 1,700, a little over 1,700 hours. Of that time, Vera, I was pretty sure that there's a lot of other stuff happening that's not billable for those staff, right? It's vacation, it's winter break, it's summer break. So I calculated this out across a school year, and or off of the number of hours, but you would spread it across a fiscal year for those folks to be able to have a real important to set those realistic expectations given each person's unique role. So you might exclusively focus stuff that some folks are doing. We take our licensed staff or some of our licensed staff, and they're doing just specialty mental health services, which I'll talk about in a minute. And then other staff are doing mild to moderate. So you divide it out. I would love to give you like a really perfect example, but it depends on the ecosystem at each one of the schools in Solano County. So as we talk to the school districts, we have to look at how are they set up? Do they allow for that time? And come up with some realistic expectations. One thing we can do is calculate out what they're doing now. So say in Solano County, if Fairfield Sassoon hasn't started billing yet, we can calculate out what they're presently doing to get an idea what reimbursement would be. And I have a tool for that you can send me an email and I'll get it to you.
Thank you. This is
So
very
sure, and reach out for, you know how to find me. I can send you that projection tool, projection instrument. The next way to fill that gap is through Families First Prevention Services Act. Now that ship hasn't left the harbor, the train hasn't left the station yet, which is probably a good thing because it's still early enough to forge that partnership with our social services department. If you are unfamiliar with FFPSA, please reach out to your supervisors. If you're not a supervisor, if you are a supervisor, investigate how FFPSA, sorry about the typo there, is being implemented in your county. And baked into FFPSA is collaborative and stakeholder conversations. So we have about a year, a little less than a year now. In October of 26, FFPSA will go live. And this is an opportunity to focus on supporting some of our higher needs kids. I think I might have an example even. Hold on. There. To support these children in our schools using a specific activity that I have on the next sheet. But children whose guardianship and adoption arrangements is at risk. Trafficked children, substance exposed newborns, children who have siblings in foster care, children whose caretakers experience substance use disorder. This is our tier 3 population of students. So we have an opportunity to partner and get reimbursed if we do these things. And one of these things should jump out to my clinical folks on the call. Well, a few of them probably jump out, but one of them, motivational interviewing, is a fantastic opportunity for us to collaborate and support those students in the ecosystem of schools. So if I was at a county, I might be looking at partnering with my school folks to make sure that their new clinicians, right, be trained in motivational interviewing. So as that comes live, they'll already be trained in an effective practice that has potential for reimbursement. So all the way back to our other conversations about integrated collaborative opportunities. This is it. Working with social services to look at, or if your ecosystem says community-based providers do FFPSA, fine. Then let's put them on or near a school campus because that's where the kids are most of the year, most of the time. Okay, next one is EPSDT, or early and periodic screening, diagnostic, treatment, and specialty mental health services. I'm not going to dive deep into this. My easy frame is intensive services for children with the highest needs versus the mild to moderate work that happens in CYBHI. But if you do these things together, and Mandy, I didn't pay her to give this example, but she gave the perfect example of how they're braiding those dollars together to fill the gap. Because she knows that CYBHI is only going to pay for mild to moderate, and then only a percentage of the time that we're exposed to those kids. We need something else to fill the gap. So, and slow, that's an opportunity. But you must collaborate with your behavioral health department. In their case, it's behavioral health doing the service. Again, in Fresno, it's schools doing the service. And I didn't see Jessica on the call, but if you're in Mount Diablo, It's Mount Diablo Unified Staff doing the service, and they've built it from a few staff to something like, I don't know, I want to say 50 staff across the district supporting specialty mental health. Okay. Sorry, guys, there it is. My clicker's not working. So just to give you an example, if you remember that last spreadsheet I used, this is the reimbursement in one county for specialty mental health. It's $241. Keep in mind, every county by the state of California has a different reimbursement rate. But if we were going to do the same individual work in this county for one FTE, the same number of hours, the total reimbursement now is $167,000. So you can see the difference here in this comparison. If these staff were only doing individual at 40%, the difference is quite high. So we have an opportunity to either have the same staff doing both or separate staff, but it's an opportunity worth investigating. I'm looking at the time, so I'm going to jam on it a little bit, hit the gas. Enhanced care management. Trinity asked for this or asked about it. I would 100% in your county reach out to your managed care plan or folks who would work with your managed care plan to talk about enhanced care management, because this is an opportunity to work with any of these clients, high utilizing adults and children, children and youth with complex needs. So we're filling that gap again between mild to moderate and intensive. People experiencing homelessness, people in foster care certainly would qualify as well. And you can do intensive case management services. Let me go back. I didn't put the reimbursement on here because it varies slightly between counties. Oh, I did put the reimbursement right there. Depending on the county, it could be $350 to $500 per enrolled member per a month. So if Miriam in Imperial County, say hypothetically the county office did all the foster youth work, had 45 children in foster care, foster and homeless services, and they were doing enhanced care management with even 3/4 of that population times 350. You can see where that would be a very healthy funding source to fill that gap. Now, please hear me on this. There were previous presentations where the person alluded to that we could just do this in schools. You cannot just do it in schools. You have to have a partnership with your managed care provider. So in the north of the state, it's partnership. Southern California, well, in Orange County, it's only CalOptima. They have one. Up in the coast where Mandy is, it's CenCal for San Luis Obispo and Santa Barbara with Shannon. So each county has a different plan, and each county would have a different way of implementing. So I'm saying something that's a little generalized, but it absolutely requires a conversation. It requires contracts to do it, but it is an outstanding way, one, to improve those collaborations and fund the services for this work. And frankly, I know I keep saying it's the presentation's about money, but that all ends up with better services and programs for kids. So I want to punctuate that here, that this is our opportunity to work more intensely with children and get them the supports they need. Really quick here, the future funding for school-based mental health. I think there might be some state growth in investments. Certainly the fee schedules in place, schools as community hubs or community schools are all potential funding strategies. I think what I showed earlier are probably the best ways to support this work in schools. A little reflections. Here's some resources. I put on the PowerPoint that you'll get if it's not already been posted in the chat. Fee schedule, the ecosystem working paper. Throughout the presentation are links for ECM and specialty mental health, etc. I love this guide from the California School-Based Health Alliance, Funding School-Based Behavioral Health in Schools, excellent resource, West Ed, Urban Institute has some good work. Leora and Angela asked me for some pearls of wisdom as I close. Number one, plan carefully and do it ahead of time if you can. It is a marathon, but in order to run a marathon, you need to kind of be in shape. Lombardo here is not running a marathon anytime soon, or maybe ever. I can tell you, I go on longer walks, but I'm trying to plan more carefully. I'm trying to plan ahead for a big hike next summer in Europe, a 10-day hike. But we have to do that ahead of time, or I'm not going to be able to do that hike. And in this case, we're not going to survive the tsunami. Be sure to use the fiscal map to track your project's strengths, opportunities, and threats. Use those tools. Call me, I'll help you find other tools, or work with the fiscal lead, Miriam, and her amazing team. Things are not just going to get better. So don't be under any illusion that it'll just get better. There'll be more grants. Somebody asked me the other day, well, we should use our capacity dollars to hire a grant writer. To find what grants? It's just not that climate right now. The federal government is not giving out money. Number four, the whole is stronger than the few. I gave you my metaphor about the sticks, but we truly are stronger than working alone. And then take time. Again, it's not a marathon, it's a sprint. A little bit of a quote here. I don't think we have time for this activity, but education is all a matter of building bridges. So please, please, please think about how we can collaborate either at the school level, county level. We're working on the state level. It's definitely, all of those levels are better than they've ever been. And Leora, or I'm sorry, Angela, I think I need to turn it back to you because we're just.
Yeah. Oh my gosh. So I took a lot of copious notes. Mike, you provided a lot of wonderful information. It's almost like we need like a part 2 next year to continue on the conversation, right? Because I know this is like continuous information that can change. I know we have some items or resources to follow up with you as well. So we'll do that tomorrow. We're going to be sending off the deck and also additional resources that Mike mentioned also through the chat. So one of the other pieces too is that if you have an opportunity, if you can please fill out our survey. We really want to know what landed for you, not just for today, but just overall. Right now we're planning for next year and wanting to get some additional information and just key takeaways so that we can make sure that we're doing the right programming for you and what you need, right? So that's really important piece here. But thank you so much for joining us. And then also, again, the information is going to be posted in the hub tomorrow. So we'll give you that information also. And if you need any TA, please, Steve is going to he already put this stuff in the chat as well. So if you are requesting any type of TA, please feel free to use that link and we'll connect you to the right person or coach that can support the work that you're doing as well. And for upcoming events, we are going to be sending a new list of upcoming events for January in the next couple of weeks. And then we'll just see you back next year and wishing you a wonderful, I know it's December 8th, but holiday break, right? As we kind of close off for 2025 and wishing you all a restful time away. Because I know Mike mentioned that this is like it's a lot of work that you're doing. So we thank you for that. So we'll be hanging out for a little bit here for the after party. If anybody has any questions, Other than that, thank you so much for all the work, and we'll see you next year. And thank you, Michael.
Thank
Well,
you.
thanks, bye. See you
Wonderful.
soon,
Look forward
Andy.
to seeing you, Michael. Yep. Thank you,
Yes.
Angela.
Oh, and
Thank you.
Miriam,
Bye.
see you
See you
both
later.
next week.
Excellent.
Bye. Bye,
Excellent.
Vera.
Excellent
Bye,
job, Michael.
Mandy.
Excellent.
Thank you.
Bye. Thank you so